So in conclusion, Gcmaf increases the cell metabolic activity by CMP signal transduction pathway. This leads to cell proliferation and differentiation. We can observe a number of newly formed cells that increases, and no apoptosis is induced by Gcmaf treatment. So Gcmaf could be used to restore a normal and efficient neuronal status without any cytotoxic effect. And our results support the evidences that Gcmaf could represent a useful tool for therapy in neurodegenerative disease or neural dysfunctions. We have to study a lot, and our future research will be focused on studying the effects of Gcmaf also in primary human neuroblast cell line, in a microglial cell line, and also in a co-culture microglia cells with neuronal cells to create a better model of the nervous system. Thank you for your attention.
I come to help just for the English. Well, we don't know whether it increases the respiratory enzymes or not. It increases the metabolic activity of mitochondria. So we don't have any insight on which enzyme is increased or less, but the transformation of these formats and salts is a common index of mitochondrial activity. It is used normally to assess cell viability and cell function.
But is it respiratory enzymes or just citric acid cycle enzymes?
Yes, it's linked to the respiratory chain, even though we don't know exactly which enzyme is affected.
Can I ask one question? Yes. I studied the research of Professor Tallberg in Finland, and he noted that before his method with amino acids and minerals has the ability to transform cancer cells into normal cells. And just before that transformation, the mitochondria change shape and become electron dense. Did you check for that with Gcmaf stimulation also?
We could check for that if we had an electron microscope that we had until recently. Now it's not working, hopefully only temporarily, because you can check for electron density only with the electron microscope. So my answer is no, we didn't, but we are planning to do this in the future.
The questions are more clinical nature. And number one, in terms of how long does it take to see the change in the neuron, and we're not maybe 1 neuron, but I'm looking more for the symptomatic improvement in the patient. That's number one.
We observed after a 24-hour treatment in this in vitro model. Yeah.
And another question, and also clinical, maybe somebody will be able to answer the question if you can. Can we follow the monocyte on CBC change? Because I often see just in simple CBC the change in the level of monocytes.
I think so, and I think this is a common observation, but please remember that these experiments have been done in vitro. There are only neurons there, no monocytes, no other cells, so this is a pure culture of human neurons, period. Of course, yes, all the effects that you mentioned have been observed and are consistent with what we know about Gcmaf.
You would have the gradual increase in monocytes.
It depends on the dosage, it depends on the responsiveness of the patient. Yes, in general terms I would say yes, even though this is unrelated to what Gabriel has been talking about.
Because I'm a clinician, so that's what I'm interested in clinical application. And what I've seen, I'm also looking for that kind of feedback from maybe other practitioners as well. Do you actually see if the increase in monocyte can be correlated to the good response to Gcmaf versus if you don't see the increase in monocytes?
Well, I think that this could be a matter of discussion in some round table, so with all the physicians and doctors who use Gcmaf on a daily basis rather than with Gabriel, who use it in the laboratory with cell cultures.